Number of COVID-19 deaths in South Africa has breached the 40,000 mark, and the last recorded death toll increased by 575. Over 11,000 new infections were also picked up in the last report from the Health Ministry. The good news is that the test positivity rate is back below the 20% mark. That's from a high of 36% during the current wave of infections. Government says the recovery rate is now at around 86%. To talk us through some of the latest data over the past few weeks, we're joined by CSIR senior researcher, Dr. Ridwan Suleiman. Dr. Suleiman, always great to have you on. So last week, you and I were reflecting on just how much good news and hope this positivity rate was giving. And you look at it now, down from 36% at our worst to about 19%. How are you making sense of the numbers?
Good evening, Thembekile. Thanks for having me. Indeed, we are continuing to see promising trends in the leading indicators, that being the test positivity rate, as well as the number of new confirmed cases reported daily. The test positivity rate is a useful indicator to quantify the number of tests as a proportion of number of cases as a proportion of number of tests conducted. Currently, the 7-day average is at 21%, and that is down from a week ago rate was 26%, so a 20% decrease from a week ago. So the trend remains promising. However, the actual value at over 20% is still high. It means that we're finding a positive case for every 5 tests conducted. We need to maintain that trend and ensure that it continues to go down well below the guideline set by the World Health Organization of 5%.
We're having a slight issue with the quality of our audio link to you, Doctor, but I want us to persevere for just a moment and ask you whether we can sustain these trends without the current restrictions.
Well, I think what we're seeing now is a reflection of the current restrictions that were implemented towards the end of December. The level 3 adjusted regulations together with the lockdown, curfew, alcohol ban, those all are reflected 2 weeks later, and we're seeing the indications of that. I think it's a bit too soon to be able to release any of those interventions and measures because the numbers and the infection rate is still quite high. And so we do need to continue to drive the numbers down before considering any easing of those interventions.
And the ideal, at least the global standard as far as the positivity rate, is 5%. We're sitting at 19%. It's giving hope, but it's not the greatest picture. Do you think 5% is a realistic goal for us at the moment?
Well, we haven't, if we look over the trend over the course of the pandemic, we haven't actually breached below the 5% level since before the beginning of the first wave. And so it's a reflection more of the number of tests that we conducted. We do indeed need to test more and test more widely to understand how widespread the infection is, and that will naturally bring down the test positivity rate. I do think we need to strategically look at how we do testing going forward, and that will influence the test positivity measure.
Something else that you've been speaking about, and I know we in broadcasting often get asked to report on this a lot more, that is the number of recoveries. In the last statement Friday night from the Health Ministry, government put that at 86%, but you've said it's not a binary figure that you can just sort of shoot from the hip, if you will.
Indeed, so recoveries are important and are really hopeful news. As you say, at the moment we have reported over 1.2 million recoveries, 86% of total cases. However, recovery is indeed not a binary outcome of having COVID-19 infection. It's not simply recovery or death. What we're reporting more is those that are no longer infectious or closed cases. And the concern is the thousands of people who still suffer from lingering COVID-19 symptoms, the long haulers, or those suffering from long COVID. And we really don't quantify those, and that remains a concern going forward.
I want us to bring up then, Dr. Suleiman, before we end our conversation, what you've been looking at as far as the breakdown from the 9 provinces, all of them reporting good news as things stand. What trends stand out for you as a mathematician? Dr. Suleiman, are you still able to hear me? All right, I believe we've lost Dr. Ridwan Suleiman from the Council for Scientific and Industrial Research, but that was